So what we use is, if the patient, sorry, this is all Chinese. I just received this lectures for 1 day before, so I cannot repair this English. I'm sorry. This is heart. This is something inside the body. What the patient was induced his pain, uncomfortable by himself, by his tissue. How to say this in English? Brain. One is psychologist, physiology, or another is I'm sorry, but it doesn't matter. I translated this. If you are hurt, if you have something uncomfortable and good in your body, it will secrete some stimulated liquid or something like that. It will stimulate your muscle, your nerve, and you feel uncomfortable.
Like cortisone?
Maybe
an autoimmune disease, like the body is producing inflammation.
Yeah, maybe. And then, if the body was hurt or he was become older, he was degeneration. The body's tissue, sometimes you will stick together. Sometimes even the spot or the minor, he was hardware, and then his muscle tendon, he will stick or degenerate together slowly and slowly. So it's adhesion or stick?
Adhesion.
Adhesion together. So he feel uncomfortable. In this way, we use the little knife needle to. We cannot say cut off. We just can say separate it. The adhesion. If adhesive between the tendon or muscle, you have a lot of nerve or something sensitive tissue. He was pressure. Pressure? Yeah. So he feel uncomfortable. So you separate it. This is little knife needles. His work chemical. Almost we use a lot of patient in the. This is a L3 lumbar process surgeon. Sorry. And are you ever heard about this disease? No?
Herniation, did you say?
The lumbar pain have more than 100 reasons. The mainly a lot of patient his lumbar pain and reflected to the lower limb is by the disc herniation, disc protrusion pressed nerve. This is acupuncture doctor. What they use almost a lot of disease to use acupuncture to treat it. But another is the L3. How many lumbar vertebrae you have? 5. So L3, this process is very long. It is longer than another one. Between in front of the process, there are a lot of nerves and the muscles. If he's doing a lot of hard work, or sometimes suddenly he cannot pay attention to what they supposed see, so he hurt this process soft tissue, and he was adhesive, and this was produced bacteria stimulated. So the patient always feel very pain, or slowly, how to say, chronic, chronic pain. It's not very pain, but he always feel uncomfortable, chronic pain, and sometimes soreness, lumbar. But he was not reflected to all lower limbs, just behind the knee. This is a syndrome, a disease. We call them L3 process syndrome. This disease was very good, suitable for use the little knife needle to treat it. You use the little knife needle to cut inside and then separate it, the adhesive tissue, and the patient feel good and feel better immediately. This is what the patient. I will call somebody to bring some little knife needle for you, show you. Sorry, Chen Bin, where's Chen Bin? Somebody is called Chen Bin.
Me.
Okay.
So you do tuna as well as operations?
Pardon?
Do you do tuna as well as operations?
And more. You do massage as well as operation.
Me?
Yeah. Do you do massage?
I do a little bit different from the massage. Maybe near the 陈明这样，我跟病房讲，那个分院病房啊，你连去拿几只小针拿过来，
那我上面也有，
你拿过来，我给他们看就得了。
几个？
这不同的号数哦，2、3，
没有这么多啊，
哪一只是吧？一只就一只吧，哪一只过来？
病房有啊，
病房有吗？有。Me, I am the orthopedic doctor, surgeon, and professor of orthopedic. What should I do? My name is Zhou Hong Hai. I am the director of the Orthopedic Research Institute and the dean of the orthopedic faculty. And I do the massage or the chiropractic or the bone setting, or sometimes the little knife needle and acupuncture at the outpatient clinic, and do the orthopedic operation at the inpatient department.
I saw you doing bone setting and I thought, do you do operations as well? Whoa. Okay.
In China, we are not very divided very clear the patient. You can use anything. What you say good for the patient. I even describe give a descriptive drug, the Chinese herbs for the patient. Sometimes Western medicine, sometimes injection. I just depend on the patient's needing. This is Chinese doctor is different from Western doctor. Western doctor is if you are acupuncture doctor, you cannot use another thing. But Chinese not forbidden. But you must pass the text examination. You have the license. And you maybe we are waiting for Chen Bin bring the needle. You are very interested from where are my education.
Oh, I was the first week I was here.
I can tell all of you, I was get my doctor degree at Shanghai TCM University.
I was just asking, in the first week we went to your clinic and we watched you do bone setting.
Are you already go home this end of this week? No?
6 weeks ago.
上面没有。
没有啊。给我打电话，你去拿一只过来。
一只，做各个型号。
各个型号的拿一只过来。Sorry.
真的不少。
It's like
It's like he works in orthopedics, so he does like
I asked somebody.
Confirm your
2008 to 2009, follow Professor Andy Carr. He was an orthopedic doctor for the shoulder. You can see him even now. He was staying there.
You are amazing.
Thank you. This is. I'm sorry. I think we should back to the lecture. This is a process of the bone, but this is my assistant do the PPT for me. I don't think this is the lumbus bone. This is a thoracic bone. To just show you. Another very common, we use the tennis elbow, little knife needle, to do at the tennis elbow. Is very good in some chronic pain, some very long times, and you cannot do by the acupuncture. How can you treat it, the tennis elbow by the acupuncture?
local
Needle. How many needle?
Depends.
5. Which shape you? 5. So 1 piece or a lot of piece?
Mainly local.
Mainly local.
And then some people think that you do it on a channel basis as well.
Some people do the channel.
Yeah.
I told you, it's a secret. Maybe if you ever learn about the needles methods, there are costly needle methods. The tennis elbow, in 1 point, 3 needle is very good. 3, like that. The shape. Sorry. We call them chicken's foot methods. You know it?
Yeah.
It's chicken's foot methods. Why? Since the tennis elbow is this muscle, yeah, it was adherent to the bone. It was inflammation. It was secreted some liquid or something like that. So the patient is stimulated a very small nerve here. So the patient always feel uncomfortable. This is one reason. Another reason is beneath the tendon, beneath this muscle tendon, have say fascial sonia or something like that. A bubble have a liquid inside. Bursa. Bursa. B-U-R-I-S. S-A-B-U-R. Have a bursa beneath this tendon. So the bursa was swollen. He was stimulated this area. So the patient feel very uncomfortable. If you use one needle, or sometimes you cannot separate it adhesive or relax the press inside the bursa. So 3 of them are very good. But the little knife needle, he was bigger and he have very sharp in the tip of the needle. So he can use as to how to say this, to separate it. Another we call them in this have somebody he know Chinese and English also. 你从哪里来？你是学院啊？啊？ 我以为你是香港人。He also Chinese. I'm afraid he was Hong Kong. He can know. If you are doing the pharmacy work, how to say this? How to say?
Farm work.
Farmer. He was use some tool to shadow. How spell it?
Dig hole.
Dig hole.
Dig a hole. Shovel.
Shovel. How spell shovel?
SHOVEL.
SHOVEL. Shovel. Maybe this one.
Or all the
Yes.
Fork.
Yeah. Shovel.
Fork.
Before
all the work.
this little knife needle in Chinese name, you can use it as a shovel to separate it. The other hand inside the tendon, but not cut the tendon, not injure the tendon. But you must have the skill
To break up.
Yeah, not break up. Just
Separate.
sorry, who's one? This is other hands, yeah, and then no, you can. Thank you. You use this little knife needle, and how to say you separate it. Separate it, but not cut this, not hurt this tendon. Just separate it. But in this maybe tendon or maybe muscle, something like that, use other hands to this bone or another tendon, another muscle. He was uncomfortable. He was swelling. The buzzer was swelling, so you separate it and make it, the liquid inside was out. How say? Release. Yes. Thank you. Maybe next year I was forgot all English. That's the tennis elbow, and another is like a tennis elbow. In English we call them another name, but it's very long. So it's here. People feel uncomfortable in the knee. It's always common, like a tennis elbow. We call them girls facial inflammation. Goose. GOOSE. Goose is something like a chicken or a duck.
The three tendons.
Here, yeah.
Peroneus, the three tendons.
Yes, you know.
On the inside, they get inflamed and stuff.
It's a buzzer here, yeah. Like a girl's leg.
Yeah.
It's like that, yeah. Yes, here.
Up to here.
Up here.
Semi-tendinous.
Semi-membranous.
Yeah.
Exactly.
Girls' muscles inflamed disease. Commonly we call them like that. Somebody very pain and uncomfortable. And then you can use the little knife needle to help the patient here. Another one is about the synovium. This synovium. The tendon, the bone. This is the tendon around the tendon. How is this one? Sheath? Maybe. I don't know. Virginal tennis. Virginal tennis. Is it virginal tennis?
Yeah, I can't remember that in any anatomy book.
Sonovage. Yeah, sonovage. This word, yeah.
Synovium.
It's a swelling. The patient feel uncomfortable. Cricket finger. Cricket finger. You use this one. But this is a little bit dangerous and a little bit harder for the doctor. You must know how the tendons pass and what the tendons through the bone. And then not cut the tendons off. But you separate the pressure in this ceramic. This is these little knife needles we use for the patient. And we still use for a lot of about the rheumatic or something like that. What he made the bone, the shape was changed. The patient cannot do a lot of things. Yeah. So the patient, he did not want to receive the operation. He was not so severe. You use the little knife needle to separate it and to reduce the shape of this joint. This is the little knife needles for even a lot of things. This is about the little knife needle, yeah? Sometimes here, how to say? 0.8 mm, still have one. Sometimes 0.6, a small one. Especially for the lady, we use the small one. For you, I think you use big one. It's okay. You feel you are very strong.
Yes, strong.
Strong's a quiet word.
Yeah, true. But what we use to make this, the steel must hard and have how to say? Flexibility. Yeah. He will not so easy to broken. If it was easy to broken, when you put the needle inside the patient's body, it's broken. It's very troublesome. Yeah. But this is very sharp. Remember, so you must know the anatomy very well. If you cannot remember the anatomy, I think you had better not use this therapy. You cut the patients. In the history of the little knife needle in China, the very severe accidents in Beijing, when they cut the patients in the disc of the neck, somebody was dying. A patient was dying. And then the hospital was corrupt. Is it corrupt? Even we could pay a lot of money for the patient's
The hospital
family, and he was no money, and then he was shut up his door. How to say? How to say this?
when the hospital pays his family
Yeah.
because he died. You got
Yeah, and the hospital was no money, and he cannot
yeah,
Bankrupt.
bankrupt.
Yeah, bankrupt.
No money, closed.
Yeah, close bankrupt. It's very, very severe accident. It's very,
Rather got paid.
yes, so you must very be careful. This 1, 2, 3, 4, how does this say? We use to separate it as a handshake. This is the first one of the little knife needle. Another to reduce the process and release the swollen muscle or something, have the liquid inside the bursa, just bursa, I think. And sometimes we cut off some fascia, a very thin like fascia in the muscle. Just the fascia. Sometimes he was advanced together. He was have a stick together in the body, in the surface of the body. The patient always feel very pain in this point. You use the acupuncture needle. It cannot help you to cut off, since it's bigger than the needle's shape tip. But if not big enough to use the operation, you use the little knife needle to cut it. This is the what we use. This one I don't think it's very good chemical. We still in research. He was cut off something calcification tissue, but it's very deep. It's very dangerous. Yeah, calcification. This I just told you, but I don't think it's good for you to use. Just one. Separate and release the pressure and reduce some swelling in the pressure and cut off some fascia. Sorry.
Dr. Jude, do you ever use ultrasound to help you guide the needle?
No.
No?
This is China. It's very cheap. You cannot use the ultrasound. If just we have ultrasound in the operation.
Sometimes we use the ultrasound to guide a needle
In the operation.
in the operation. Or a cyst,
Yeah.
like a cyst.
Yes.
Or
Ultrasound.
tumor.
Yeah. In the operation we use it. But the little knife needle, you don't use it. If you use ultrasound, I think it's more than 2,000 or 3,000 yuan. If we just use little knife needle, we'll keep with 50 yuan.
So they're only 50 yuan each.
So one shot, one point, 50.
And single use.
Pardon?
Single use. Use it only once.
No. Just according to the patient's disease, what the disease needing.
But you only use it on one person and throw it in the garbage bin.
Yeah.
Yeah.
Normally we don't use more than 4, less than 4. I think it's enough. If you use a lot, this is acupuncture. It's not a little knife needle therapy. Why? This is to cut off, to separate it. It's not only according to the channel, but he have another series to release the adhesive press, not only depend on the anatomy. This is we call them concentrated point, the energy concentrated point. What's the energy concentrated point? Is I can just say, if you work very hard, you are paid in a number, but you still feel uncomfortable around your knee. What's the reason? The reason is the knee, you have a lot of muscle from the lumbar, from the pelvic, from the joint, hip joint to the knee. Yeah? But this muscle, he have 2 tendons adherents to the bone. One is around the lumbar, around the hip. Another is adherents in the knee. If you just release the point around the hip, around the lumbar, you find the patient, he was released the lumbar, but he still feel uncomfortable. This time you must use the little knife needle to separate the energy concentrated point around here. Since when you work, when you move, the energy was through the muscle from the lumbar to the knee, and these have adhesive problem. Sometimes he still have an adhesive problem here, but you always concentrated your pay your attention around his lumbar, but not think about the muscle. He was long. He can translate it the energy from the lumbar to the knee. So the knees, other hands problem, you are not soluted, he will feel uncomfortable still. This is the energy concentration theory. Understand? It's very complicated a little bit.
Trigger points?
Referred pain and trigger points.
Maybe it's trigger
Adhesions
point,
in
but he
muscles
was not
that
around
associate.
the
Location.
place. What you is in another way. It's long. It's like a channel, long time. Sometimes it's around the ankle, but actually the patient feel uncomfortable just in the lumbar. Trigger point maybe. Good. Sometimes a scar, it needs the tendon. Sometimes an unexplained pain around the joint. We also use this little knife needle. Sometimes around this is very complicated, complicated tendon, ligament. He was hurt, and it was hurt, and if the patient feel very pain, you cannot use the operation since it's a little bit 1 point. Use acupuncture, you cannot. How's this one? Sorry, sharpening. So we use this one. Use the little knife needle. You can see which one is. Oh, sorry. Okay. Oh, sorry.
Slash.
Defects to synovial inflammation. Synovial inflammation. Another is the tendons inflammation, and sometimes scar after operation. The forbidden of this therapy, ladies and gentlemen, is, I think you must pay attention for this. The forbidden for this therapy is one, the fever. The patient has fever. It means he has bacteria inflamed inside. You cannot use the little knife needle. The little knife needle, he can cut off the tissue and make the inflammation spread out. So it's dangerous. Another is somebody he have a severe patient inner disease like heart disease, the liver disease. The little knife needle therapy is forbidden also. And then any inflammation around the skin and ring around the muscle is also forbidden for use this therapy. Any important blood vessel, important nerve is forbidden to use if you are very clear in anatomy or you are very good operation surgeon. You still can use, but if you are not clear, this area have important nerve or important blood vessel or not, I think you have better use this therapy. Like this, why place any important nerves here? Here.
Yeah.
You are very clear. How about you? Not clear?
Not clear enough.
Another one.
Ulnar.
Ulnar, yeah. If you cut it off, the hand, this finger cannot work. Careful. Somebody he have a bladder disease. It's like he was very easy to hurt, very easy to become black and black and white,
Bruise.
Brew. Yeah, brew.
Hemophilia.
Hemophilia, like something like a hemophilia. So you have better. I think it's forbidden to use this therapy. High blood pressure, the very weak patient, like the old people, old lady, I think you have better not use it. How can we? How to do this therapy? One, please see the picture. Yeah. The first step is you must first to aim the point what you to do, where you to do. Actually, the doctor always use the blue liquid in the medicines. We use them to anti-inflammatory about the skin's problem. Maybe, I don't know. You just call him. How to say his name? Yes. Put here, market. And then another step is anti-infection. Yeah. Use this one. Yeah. How to say?
Oh, iodine, betadine.
Betadine. Yeah, thank you.
Iodine.
And then the first step is use this little knife needle to put in above this point to decision which direction you will go. This is very important. If you go to long direction, you cut the blood vessel or the nerve. And then put the needle inside the body. And then it's okay. See it?
Okay.
Huh?
We're laughing at this, the patient. So.
Which patient?
He's having lots of fun.
Yeah, I think so. And then after the operated, we call them limited operated. We use this. How's it? Band-aid. The Band-aid. Maybe something like that. Sometimes we use another thing, Band-aid, to cover it. It will anti-inflammatory, anti-bacteria. Yeah. And then ask the patient not washing this hurt, swelling place just 24 hours, and this is okay. 1, 2, 3, 4 step. And you remember this step? Maybe. How we can use this is that one is like that. Put the needle knife inside and then separate. Like, see this separated, and how to say this in English? Never know this word.
Rock.
I don't think.
Many words.
Many words. Show me one.
On an axis.
Swivel.
Rocket on an axis. Separated on an axis. In like this.
Oh, no.
No, like this.
I'm sorry. I say this is not for you as a gifter. I must collect after the classes. I borrow for the handlers. So this
and
inner and them. And if two. Sorry, he's swallowing.
Does the sharp blade
Yeah.
go
This,
this way?
no. That this something was at the hands like that, and I put inside, and then
Alright.
how to say?
Yeah.
It just separate it, also separate it, but you must separate it in the horizontal. How to say that?
That's how you say it. You separate
Separate
it
on the
in
horizontal. And a special word for one word for that? No.
I don't think so.
What's this plane?
But in Chinese, we have a special word for that.
Oh, okay. We probably do too.
Maybe another.
Maybe. Another separated is a separated, not in the horizontal, is like that. How to say?
Lateral.
Maybe. Lateral? Longitudinal. Maybe separated longitudinal.
This is coronal,
Yes.
sagittal,
Longitudinal.
sagittal.
And then some is cut off. The third is cut it off. Yeah. Number four. Number four is what we say this sticking. Yeah. Striking. Separate.
In and under.
In and under. And number five is this is a scar. Not only in solid, but we cut it off. This is what we use. How can we use this one? How can we what we will use from what mark? The mark of the electronic needles on the surface of the body is one is according to the bones mark, so like tennis elbow, the goose bursitis inflammation. You can find a bone. It was processed, some processed. Something was have a hole. Something was like the lip. You find 1, 2, 3, 4, 5. According to lips. Yeah. Bones mark. Another, the tissues mark. You find the tissue. You will find the tissues not. You will sensing touch. You find the tissue. Some place is hard. He was pain. Sometimes there's a numbness. This is what the place you will use the electronic needle. Anything. Anyway, we must know not to make the bacteria inflammatory the area what you will do the electronic needle. This is very important. Since his hurt is swelling, hurt the tissue. And then it's very difficult to tell how can we use in the approach way, in the neck, in the shoulder, in the lumbar, in the abdomen, in the lip is different. But I think it's too complicated for all of you. If you have time next time, come to Nanning, I will tell you. The only one is you must very clear in the anatomy. And sometimes you know the energy translate way and find the energy concentrated, the trigger point maybe like that. Another is I will tell you the some picture. This the research we're doing with the Beijing TCM college university. This anatomy, this real page, the human's body. You will find a lot of blood vessel and this artery. How to say this? Vein. The vein, arteries, This, and then not very clear. Yeah, good. This nerve, see nerve?
Yeah.
This nerve. This is the trigger point and the little knife needle. What we will go for. Sometimes the operation orthopedic doctor they just aim on the very big, the bone fracture or the big nerve was pressure, but they are not any sense about this area. But the patient is feel very pain. You find this nerve was pressed by these tendons or these tissues, not only tendon but also the synovial, the bursa, the fascial or ligament or something like that. Especially the knock. So the patient will feel very pain. Here, please pay attention to this way, ladies and gentlemen. This way, this is the ligament. Maybe it's fascial. Yeah, but here have a very small hole, and now a very small nerves come out from the very small hole. Sometimes you are hurt. Sometimes it's like a tiny TCM cereal. You are sit down on a very cold place. This will inflammation, but it's bacterial inflammation. So he was swollen. And then he was pressed this hole. This hole will become narrow and narrow. And this nerve was pressed. And the patient will feel pain if you uncomfortable. But this is just under the fat, maybe. Under the skin, it's not very big problem. And the surgeon, you don't care about it. You just go home. We give you some medicine. If it was fresh hurt, the medicines work. If it was chronic, so many times, so long times after before the patient go to the hospital, this already becomes scar. He will pain, always pain, and the surgeon did not care. The patient will come to your clinic. You use the needle, but the needle is not sharp. This time, use the little knife needle to cut off these holes. How say? Maybe
to open it up to widen.
Yeah. Open it wider. Relax the pressure. This small nerve will not be present. The patient was released immediately. This is the chronic, maybe like that, chronic of the little knife needle. Understand now? But please pay attention is, if you use the little knife needle, please don't cut like that. Just like that. So you open the, we call them hole, maybe can also. This open the holes and release the pressure. We told you all about so many times, spend you so many times. Just one picture can show you. Understand? So we use this one. How is this one in English? It has special name in China. 老师，那个跳怎么说？
I'm sure there is the word. We know what you mean. An incision. It's like a.
Is like. Sorry. Oh, here. Who's?
She's the nurse. She should know.
There's one open here.
Okay. Cool.
Yeah.
Can you see it? This is the green. You see? Open this bag, and then he still have a tube. So And then, how to say this?
Oh,
Don't know.
pain.
Huh? Pay?
Pain.
Picking, it's like picking,
Picking?
right? Yeah.
Picking up?
Kind of,
It's almost
Kind
gouging.
gouging or picking.
Scraping.
Picking also means to pick.
No. This is pick. No, but
You can unpick clothing as well, like.
this I show you is very big. But if you ever do it like that, also separated. Yeah, everything is separated. In China, have different words to name this separated. The horizontal separated. We call them boli. This translated separated, we call them 纵向玻璃. This way we call them tiao. It's different word. But in English I don't know. Sorry. Maybe you have.
Vertical, horizontal, lateral.
Lateral. Are you good? How is it? Please write it for me. Next time I will tell them. Still another. Please see this one. This is we use the rat to do the experiment. This is his novel. It was pressure. It had a very small blood vessel to support the nourishment to the nerve. But if he was pressed by the soft tissue, it become narrow. See? This is the normal. This after pressure. Just his muscle pressure by himself. It's narrow. The rat we feel pain maybe, but he cannot tell us. I think he is uncomfortable. And now, see? It's different, yeah? It was pressed, different. And then, we use the little knife needle to separate the press, to release the press. This before, this after, recover. See? Recover. I think after the therapy, the rat will feel very good, feel comfortable. Actually, cannot tell. This is what we do under the microscope. Before and after, this is pressure group. Pressure group, the nerves, he was changed. His fiber is changed. And the therapy group relax the pressure, reduce the pressure of the around the nerve. You see the faster? See faster? One
Fibers.
fiber, yeah, fiber. F-I-B. Be a fiber. The fibers is good. See again. It was concentrated, narrow, confused. Yeah. But this one, the fiber, he was in order. It's good. So this is what we use. I don't think you interested in here. I will show you another picture about the this is patient. He feel very uncomfortable. He was lay face down, very uncomfortable around this hand. But he just feel uncomfortable. We cannot cut off this screw. Yeah, it's needed to cut off the screw. He already doing the MRI, CT, or anything about his brain. No problem inside his brain. He just feel headache And then we find here. Here he have a little bit very shallow, a hole, not very deep. How to say?
Shallow.
Shallow, yeah. And here, actually, he have a big narrow around this way and to the skull, top of skull. But in this way, a very, very small ligament, no name in the anatomy book. From this way to this way, cover above this nerve. And he was hurt before. So this ligament was contract. Was contract. The pressure was higher above the nerve. It's like the red. Yeah. So another, then we use the. I don't think we have the picture about it. We used a little knife needle to cut inside and then separate it. Just separate it, yeah? Separate and release the pressure. All this ligament, we can cut separate. Two parts. Make it become two parts. How to say it? And then just separate. Cut off, not cut off. They always cut
in between. So you
in between.
Like if you go between ligament and nerve and you separate.
Separate, not only separate the ligament, we make it two parts.
Yes.
Then you cut.
Just say cut. Saber, yeah, saber. And then the pressure was released.
So from the bone, you mean
yes.
Cut from the bone?
From the
to
bone.
Make the hole bigger.
Sometimes we do not cut from the bone, the ligament. Give me one tissue. This is the ligament. Whose coffee?
Yours.
Me? This is the bone. This the ligament. It's pressure in above the nerve. And then we put inside. First put inside. Please see here, ladies and gentlemen. You are not like that. If like that, you cut the nerve horizontal in and then turn around, and then this is a big ligament. Yeah? And then if a little big ligament, he will be separated to two parts.
Yes.
The good is separate two parts above the nerve. Another is it's very dangerous to separate it above the nerve. Yeah. We put inside and then separate it. The adhesive, he was adhesive in the bone.
First one is to cut.
Yeah.
This one is to separate.
Separated. This cut is separated. Separate the ligament and the bone. So release this pressure. This patient is dead. Another patient is shoulders problem. We use it. This patient is shoulders problem. This is an elbow. This is another problem. It's a very complicated disease about the nervous pressure. In here is another nervous pressure syndrome. I don't know how to say it in English. It's very weird.
There's a few different ones.
Very
Compartment syndrome, when the pressure in their muscles is too much.
He have a very a small nerve around here. It was come out from a little bit hole here. Have you ever noticed them?
No, I'm not sure. Nerve compression, maybe.
Maybe. This is we're doing the little knife needle upon his neck. This is a lady. He was very brave. Yeah. This is another patient. You can you can see this picture. You can know how the little knife needle works. This is another nerve from here, crossing this pelvic, and then if you pay lumbar and feel uncomfortable, just not pain, uncomfortable of the lower lip, so we release here the whole the nerve to go out, and then this energy concentration here, trigger point, release this one. The middle is here 1, 2, 3. Another assistant point here is just 1.
3, maybe more needles for larger areas.
Maybe, but all this is find the trigger point and the point where the nerve was present. I will show you the red and the body picture before. Yeah, I will show you. So this angle, okay. I'll show you another picture about this. Is please wait a moment, gentlemen.
Don't forget the ladies.
Yeah, I'm sorry.
Right.
This one. This one also the patient will feel uncomfortable around the lower lip. Why we put the needle here? This also have a nerve pass from this part. 1, 2, 3, 1, 2, 3, 1. And anatomy is like that. And you will mark it. It's a little bit complicated. Mark it, and then you find the trigger point. You find the place where the nerve was present, and then you cut it, release. Sometimes synovial are covered in the muscle is a white tissue, synovial.
Yeah, membrane.
Membrane, yes. The membrane fascia. The fascia cover in the muscle. Sometimes he have a trigger point, very pain, yeah? Use this one. Use the little knife needle. But this time, you need it to cut off since it's in the surface. Yeah? Fascia is very smoothly, very softly, but sometimes he was hurt. He was concentrated as a knot. This knot have a lot of knowledge, a lot of nerve. So the patient will feel uncomfortable. Use this one, cut off, and make it smoothly again. That's the patient feel good, feel better. Okay. Still did I show you? This is another supraclinical nerves. Here, the nerve from this way. It is easy to chop. Say chop, they're easy to chop. So you can use the little knife needle to separate it, to release the pain. How to use is 1 mark, 2 pressure, 3 inside, and then separate it. This
Walk at the beach.
Holiday.
holiday, yeah. Thank you. I think you can ask a lot of questions. If I can answer any problem.
How long does the general treatment take? Like how quickly is this done? Is it sort of jabbed in, out, done, person's on their way?
Oh, no. It's depend on the patient.
Okay.
It's the problem and depend on the disease. Sometimes it's like what you say, 1 minute.
Yeah.
Okay. Sometimes you must find slowly, because the problems it needs very deeply. You must very concentrate and very carefully.
And the risk of infection, what's the general risk of infection compared to actual surgery, for example?
Actual surgery. Sorry, pardon, what you mean?
When someone gets cut open in surgery, they're very likely to get an infection. But is it less likely that they'll get an infection because it's a very minor procedure, not as invasive?
So
I think you just asked that even
the
more
infection
complicated.
when the skin is open and it gets inflamed and bacteria. So in surgery, when they cut you open, there's a high risk. Is the risk the same with small knife, or does the place where you cut get infected? Does it get
infected
afterwards?
After it get infected after the operation?
Yeah. Is the risk high? Is it common?
No. And we not use this little knife needle anyway. We have a special room for the little knife needle. We have the line, how to say it, to stimulate it, to kill the bacteria, how to say it.
Okay.
Unlike
Sterilize.
No, a special line for sterilize. He will keep his blue, his line is blue. How to say this one?
Yeah, ultraviolet.
Ultraviolet, I think so. You must have one special area. It is separated all these other patients in. Just you and the patient what they need to do this operation. And every day you must sterilize this. Use the actual what?
Yeah, you must sterilize the room.
Yeah, must sterilize this. The room every day. And it was cleaner. This is good. But if in the emergency problem, or you think it's good, I think this environment is good, you can use. I think in the Australia's still like the environment is better than China. I think I have been to lobster. The lobster, the operation after in China, in South China, after operation, we must to use the anti-infection drug like penicillin or something like that to pay for the patient, supply for the patient 3 days or 1 week. But in Russia, no. After operation, good, you go home. Why? The lobster is very, very cold. I think it's under degrees, 40 degrees under zero in the winter. So no bacteria can grow up. They just cut off and then suture and then give the patient some fish or some meat and then you can go home.
It's because they drink so much vodka.
Maybe vodka is a very good material for sterilizes. In Oxford, they just give 1 day sometimes. But in south of China, I think 3 days or 7 days, we must give the patient to anti-infection jab. So it's a different place. Any question?
So what sort of recovery time are people looking at? So say, for example, the one you showed us with the head, for example, how long until they're fine? What sort of recovery time?
Recovery time. Since the separated this little knife needle therapy, sometimes we not only do 1 times. 1 week, 1 times. We ask the patient, just like the patient, 3 times. He recover. This is depend on the patient disease. One reason is too pain. In China, we sometimes use the anesthesia, a little bit anesthesia drug injection to the area. But for me, we also not give any anesthesia drug injection for any patient. Since if you anesthesia the patient, the patient he will not feel pain anymore. You cut off the nerve, he cannot reflection. He cannot tell you. If you pay, you are the shaft was cutting the blood vessel, pain. Numbness, shocking, like electric shocking. You are touching the nerve. So the patient tell you, you must be careful and retreat it a little bit. That's good. But your anesthesia, the patient, he cannot tell you anything. But in the number 1 hospital, Dr. Hall, he was very injured to give the anesthesia before the little knife needle. That's if one is he give a little bit a lot of knife inside the patient's body. Another reason is he have a very big and long needle. Sometimes in the lumbar, he need to put inside very deep and separate a long time. The patient cannot patient it. For all of you, I think there is little knife needle suitable for you to do the surface problem. I don't suggest any deep tissue for all of you, since I don't think how long anatomy you have learned. And I suggest this any little knife needle doctor, he had better had done the operation before he do this therapy. If he do the opening operation before this therapy for a long time, even 1 year, 2 years, he can have his mind any anatomy of the leaf body of the human. So he can have a mind. He can know, we cannot use this needle in this area. We can use this needle in this area. The leaf body is a little bit different from the dead body or the body, just the body. A little human is different.
About that, everyone is a bit different. You can study anatomy for a long time, but some nerves go in a different place.
Yeah. This is very special.
How much do you feel with the needle, or how much do you ask the patient? Like you're saying, if you touch a nerve, you can retreat.
Yeah.
How much is just anatomy? Do you needle because you know, or do you feel and slowly feel with the needle?
I think the special neural path is very rare. A few, yeah?
Yeah, only a few.
Yeah, very, very few. First one, we must ask the patient what's the seizure he have. What's the problem he have? Another one, I think there are a lot of, maybe more than 90% patient is the common anatomy. You can according to common anatomy. The third reason is, if you are cut off a very small nerve or a small blood vessel, it doesn't matter.
This is China.
Yeah. This is China. No, even in England on Russia, I saw them. If you cut the small one, just small one, the patient he will feel uncomfortable. No, anyone he feel very comfortable. Since you saluted the problem of him or of her, but if you cut a big one like this ulnar, this is a problem. But you know the patient's brother vessel or the nerve all around the body is very common, a lot of. So it doesn't matter. So this is why I suggest to you, if you use this therapy, just around the surface of the body. It's good. Thank you. Understand?
Yeah.
It's very,
You still can see this one. This what we do the anatomy. This is the body, yeah. The neck. You can see a lot of nerve around here, the whole. So if you have any sense in your mind, any picture in your mind, the human bodies, you can put your needle here, separate it. But here, see, very nice. So be careful. But here is a lot of nerve out of the tissue. If this tissue, the muscle was contract, you must press this nerve and then you separate it, you feel better. If you are afraid you cut the patient's nerve, the patient you feel uncomfortable and you are guilty. Yeah? So you have better use the acupuncture. Even use the moxibustion. The moxibustion can give the warming, and then after the warming, the blood vessels is supported, is nourished, so he feel better. But still, if it was present severely, you have better separate it. If you cannot, you are fear to use this, you just use the chicken hands needle methods. I think it's safety. But it's slowly. This is in China. You always use 1 or 2 or 3 needles for one patient, one case, one time. So I think it's a little bit expensive than the acupuncture. This is why now the little knife needle therapy was abused. I think it's a little bit abused. Even for the countryside doctor, they use this. But in the big country, big city, we use it very carefully. We just depend on the patient's needing. I think sometimes you have a little bit economic reason, maybe. Any question?
I think you've explained it very well.
you were very thorough.
Thank you. I'm sorry I'm not speak English well now. Then we just come back from England. But you are lucky. You are listen to me this year. Maybe next year I can speak half of this time.
You did well.
You've been
Thank you.
Yeah, better now than